every man should know what TRT is. TRT stands for testosterone replacement therapy. The important part is the R, replacement, because this is what happens when you go on TRT. Your body, if you're a male, has a natural negative feedback loop that monitors your level of testosterone and estrogen, and based on that determines how much testosterone it produces. And testosterone then aromatizes to estrogen. So in men, the amount of estrogen and testosterone should always be proportional, and estrogen is essentially regulated as a byproduct of testosterone production. Testosterone, the male sex hormone, is very important for vitality, mood, well-being, libido, all of these things that many people are probably aware of. And as you age, all of these things start to decrease. Those are the side effects of decreased testosterone levels from aging, especially when you get past 50. Most of this decline is actually preventable in large part by maintaining a healthy lifestyle and a healthy body composition. But at some point your levels will decline, and then I think every man should know what TRT is and consider going on it. I myself am most likely going on TRT by the time I get to that point where my levels start to decline. Now, I've noticed that a lot of fitness influencers these days, especially the last couple of years, are suddenly on TRT. And there are a lot more people on TRT. And I think that's in large part attributable to Joe Rogan, who's a proponent of TRT. And I think that's great. Like I said, I think all men should be aware of TRT and should consider it. But you have to know that when you go on TRT, it replaces your whole natural production. Normally what you do is you give a certain level of testosterone to put your level somewhere in the normal range. Like the standard original medical use of TRT is that when your levels are no longer at least normal, you replace that and all of it because of the negative feedback loop. So you can't just add a little bit of it. You have to replace all of it, because if you only replace a little bit of it, then your body just makes less of its own. So you have to completely shut down your entire natural production, and then you can put your level to where you want it. Then the nice thing is that you can also put your level a little bit higher. If your testosterone level was naturally here, this is the reference range, and it was like here, which is like, okay, maybe it was okay for you, but not as great as it could be. Maybe you'll feel better mood, better libido and the like when you're here. And probably that's also what I would consider, and what I have some clients on TRT, and typically I advise them to go higher if all blood biomarkers are still in the normal range. In particular, you want to check your cholesterol profile, all the standard checks for diabetes and the like, but that probably won't be an issue. You want to check liver function, kidney function. Those also shouldn't be really an issue. The main things are your cholesterol level, blood pressure, and prostate-specific antigen. And of course also your follicle-stimulating hormone and luteinizing hormone to check that they are fully suppressed. If they're not fully suppressed, you probably want to use a bit more because you're not even fully recovering or replacing your natural production. On TRT, you just have the option to put your testosterone level where you want it. And that's great. But it also means that you're not really on TRT anymore when you go over that level, because TRT is supposed to replace your natural production. So there are, I think, now a lot of fitness influencers that are basically saying they're on TRT, and TRT is actually even being used as a euphemism for basically being on steroids. Typically, there have been two ways to use steroids, and those are cycling. So you go on steroids for certain periods of the year, and then you go off at other periods. And another method that I think is much more popular, especially among the high-level bodybuilders, is blast and cruise, which means that you're on a certain low level, like TRT, if you will, of steroids most of the time, but then sometimes you go on a higher level during a blast. If your levels are above the normal range, or if they are considerably higher than your natural levels were, you are not on TRT, right? That's disingenuous. You are cruising, and that may be fine. In fact, I myself, when I go on TRT, I might consider going a little bit above and beyond that to the level where I'm not just replacing my natural level, but I'm going to the point where I'm high in the normal range, at the top of the physiological range, or even above it, as long as all the other biomarkers that I just told you about are still optimal. So all the indications are that your health is still optimal. You have no adverse effects yet of the testosterone, because of course, too much testosterone has adverse health effects, in particular on the biomarkers that I just mentioned: decrease in HDL cholesterol, increase in blood pressure, and potential for increases in prostate-specific antigen, which could be an indicator of prostate cancer risk. Although I'm personally not super convinced of that relationship. And it's fine to set your testosterone level to a point that is higher than it would be if you were natty, but then don't call it TRT. And in particular, if you're just cruising on a clearly super physiological dosage of testosterone, don't say you're on TRT. It's disingenuous, because on TRT, this is important to realize, like on normal, medically responsible and medically supervised TRT, you are essentially natural for basically all intents and purposes. It doesn't matter if your testosterone comes from your gonads, your testicles, or from a needle, or a patch, or whatever. Testosterone is testosterone. In your body, it exerts its effects by mediating, or that are mediated by the androgen receptor, so the testosterone binds to the androgen receptor, and therefore exerts anabolic and androgenic effects in the body. It doesn't matter where the testosterone comes from, and if only the total dosage essentially matters, the total level in the blood that you have. And if that level is the same as if you were natural, you have the same effects. So if you are currently natural, you have a good level of testosterone in your body, and you go on TRT, that makes no sense, because you're just shutting down your entire natural production for no reason. You're just replacing your natural testosterone with exogenous testosterone, and the effects are the same. So it's not a risk for your health, with very few exceptions. Most intents and purposes, it is exactly the same for the body. So all you're doing is you're shutting down your natural production for no reason, because the physiological effects of the testosterone are going to be identical, pretty much. So true TRT does not offer significant physiological advantages. If you set your level higher than it was when you were natty, there will be advantages. I recently did a video on this that you can check out, where I show that even in the physiological range, higher levels increase your ability to build muscle and result in a higher lean body mass. But the effects are not nearly as large, clearly, as when you are cruising on higher dosages of testosterone. And that, I think, wraps up what all men should know about TRT.